Every day, millions of people wake up with pain that starts in their lower back, then travels into the buttock, down the leg, sometimes all the way to the foot. Most people hear one word, sciatica. But here's the problem. Not every pain that travels down the leg is actually sciatica, and that misunderstanding leads many people to try treatments that aren't right for their situation. Today, we're going to separate myth from reality, explain what sciatica really is, discuss common mistakes people make, and talk about when it's important to seek medical care. Let's begin. Before we talk about treatment, we need to understand what sciatica actually means. Sciatica isn't a disease. It's a term commonly used to describe symptoms related to irritation or compression affecting the sciatic nerve or the nerve roots that contribute to it. The sciatic nerve is the largest nerve in the body. It begins in the lower spine, travels through the buttock, down the back of the thigh, and continues into the lower leg and foot. Because it's such a long nerve, symptoms may travel along that pathway. That's why someone might feel discomfort in the back, the buttock, the leg, or several of those areas at once. Sciatica describes the pattern of symptoms, not necessarily the underlying cause. This surprises many people. Pain traveling into the leg doesn't automatically mean the sciatic nerve is the problem. Different conditions can sometimes create similar symptoms. Pain may be referred from the lower back. It may involve joints. Muscles around the hip can contribute to symptoms. Or the sciatic nerve itself may be involved. That's one reason why self-diagnosing based on a social media video can be misleading. Similar symptoms don't always have the same cause. Understanding what's contributing to your symptoms is an important part of choosing the right management approach. Now that we understand what sciatica is and why not every case of leg pain is actually sciatica, let's talk about 5 common mistakes that can keep people confused, frustrated, or stuck. These mistakes don't mean someone has done anything wrong. Most people are simply trying to feel better with the information they have, but better information can lead to better decisions. Mistake number 1, ignoring symptoms for months. The first mistake is assuming the symptoms will disappear on their own, even when they're persistent or getting worse. Some cases of sciatica do improve over time, but symptoms that continue for weeks, repeatedly return or interfere with walking, sleeping, or working deserve attention. This is especially important if you begin noticing weakness, increasing numbness, or changes in how your foot or leg functions. Waiting indefinitely doesn't always make the situation more serious, but it can delay an appropriate evaluation and a clearer understanding of what is happening. You don't need to panic over every ache, but you also shouldn't ignore meaningful changes in your body. Mistake number 2, trying every stretch on the internet. The second mistake is trying every sciatica stretch you see online. One video tells you to stretch your hamstrings. Another tells you to stretch the piriformis. Another promises one movement will release the sciatic nerve in 30 seconds. The problem is that similar symptoms can come from different causes. A movement that feels helpful for one person may irritate someone else. If a stretch repeatedly causes pain to travel farther down the leg, creates new numbness, or leaves you significantly worse afterward, stop and reassess. Stretching is not automatically bad, but more stretching is not automatically better. The right movement depends on the individual, the pattern of symptoms, and what may be contributing to them. Mistake number 3, avoiding all movement. The third mistake is becoming afraid to move. When pain shoots down the leg, it is completely understandable to become cautious. People may stop bending, stop walking, stop exercising, and sometimes spend most of the day sitting or lying down. A short period of modified activity may be appropriate during a painful flare-up, but for many people, prolonged inactivity can lead to more stiffness, reduced conditioning, and less confidence in movement. The goal is not to push through severe pain. The goal is to find tolerable movement. That might mean a short walk, changing positions more frequently, or gradually returning to normal daily activity. Clinical guidance commonly encourages people with low back pain or sciatica to continue ordinary activities as reasonably tolerated rather than relying on prolonged bed rest. Mistake number 4, expecting overnight improvement. The fourth mistake is expecting the symptoms to disappear immediately. Sciatic type pain can be intense, so it's natural to want a fast solution, but nerves can remain sensitive even after the original irritation begins to settle. Recovery may not follow a perfectly straight line. You may have a good day, followed by a more uncomfortable day. That does not automatically mean you are back at the beginning. Progress may look like walking farther, sleeping longer, having less pain in the foot, or recovering more quickly after activity. Instead of judging recovery hour by hour, look for gradual changes over days and weeks. Improvement is often measured in trends, not perfection. Mistake number 5, ignoring warning signs. The fifth mistake is the most important. Most sciatica is not an emergency, but certain symptoms deserve prompt medical evaluation. Seek urgent care if you develop new changes involving bowel or bladder control, numbness around the groin, inner thighs, or saddle region, severe or worsening weakness in both legs, symptoms affecting both sides, or severe symptoms following significant trauma. These signs can indicate serious nerve involvement and should not be managed by simply waiting, stretching, or watching another video. The goal is not to frighten you. It is to help you recognize the difference between symptoms that can often be monitored and symptoms that should be evaluated quickly. So let's review. Don't ignore symptoms that persist or worsen. Don't try every stretch without considering how your body responds. Don't let fear eliminate all movement. Don't expect recovery to happen overnight. And never ignore important warning signs. Sciatica can feel overwhelming, but understanding these common mistakes can help you approach the problem with more confidence and fewer assumptions. So what often helps? That's what we'll explore next. So far, we've talked about what sciatica is, why not every pain traveling down the leg is actually sciatica, and 5 common mistakes that can make recovery more difficult. Now let's answer the question everyone wants to know. What actually helps? The honest answer is that it depends on what's contributing to your symptoms. That's probably not the answer most people want to hear, but it's the most truthful one, because there isn't one stretch, one exercise, one adjustment, one medication, or one treatment that works for every person with sciatica. Different causes often require different approaches. That's why understanding why you're experiencing symptoms is so important. One recommendation you'll hear frequently is to stay as active as your symptoms reasonably allow. Years ago, prolonged bed rest was commonly recommended for back pain and sciatica. Today, the advice is different. For many people, gentle movement is encouraged because staying completely inactive for long periods can sometimes lead to increased stiffness, muscle deconditioning, and reduced confidence in movement. That doesn't mean pushing through severe pain. It means finding movement that feels tolerable. Sometimes that's simply taking a short walk. Walking is one of the most accessible forms of movement. It encourages circulation, keeps joints moving, helps prevent prolonged stiffness, and allows many people to stay active without placing excessive demands on the body. If symptoms increase dramatically while walking, that's information worth discussing with your healthcare professional. But for many people, small walks are a reasonable place to begin. Another important part of recovery is learning how to pace yourself. Many people make one of 2 mistakes. They either stop doing everything, or they try to do everything they used to do immediately. Neither extreme is usually ideal. Recovery often happens somewhere in the middle, a little activity, a little rest, then gradually increasing what your body can comfortably tolerate over time. Think of recovery like climbing a staircase. Some days you'll take 2 steps forward. Some days you may feel like you've taken 1 step back. That doesn't necessarily mean you've failed. It simply means healing isn't always perfectly linear. Sleep also plays a bigger role than many people realize. Your body performs many of its normal repair processes while you sleep. Poor sleep can increase fatigue, reduce your ability to cope with pain, and make symptoms feel more intense. If you're not sleeping well because of pain, it's worth mentioning that to your healthcare provider. Improving sleep can become an important part of the overall recovery plan. One question I hear often is, should I keep exercising? The answer depends on the exercise and on your symptoms. Some activities may temporarily increase irritation, others may feel comfortable. The goal isn't to avoid exercise forever. It's to choose activities that your body tolerates while gradually returning to normal function. That's why individualized guidance can be so valuable. You may also wonder whether you should see a healthcare professional if your symptoms aren't improving, keep returning, or are interfering with your daily life. An evaluation can help determine what may be contributing to your symptoms and discuss appropriate treatment options. Sometimes reassurance is exactly what's needed. Other times, a structured treatment plan can help guide recovery. Perhaps the most important thing I want you to remember is this: don't chase miracle cures. If someone promises to cure sciatica in 30 seconds, be skeptical. Recovery usually isn't about finding one magical movement. It's about understanding your symptoms, making informed decisions, staying consistent, and giving your body time to recover. That may not be the most exciting message, but it's the one most supported by what we know today. So, what have we learned? Sciatica isn't one disease. Not every pain traveling down the leg is actually sciatica. The same advice doesn't work for everyone. Recovery usually isn't about doing more. It's about doing the right things consistently. And most importantly, understanding your body is the first step toward helping it recover. If there's one thing I hope you take away from today's video, it's this: understanding your body is often the first step toward recovery. Pain can be frustrating, sometimes even frightening. But the more you understand what's happening, the more confident you become in making informed decisions. Recovery isn't about finding one perfect stretch, one perfect exercise, or one miracle treatment. It's about learning, staying consistent, and taking one step forward at a time. Some days will be better than others. That's part of the journey. Don't let one difficult day convince you that you're not making progress. Keep moving, keep learning, and keep believing that improvement is possible. Thank you for spending part of your day with me. If you found this video helpful, consider subscribing to Dr. Recovery. Every week we'll explore the science behind pain, separate myths from facts, and help you better understand your body through evidence-informed education, because knowledge reduces fear, understanding builds confidence. Until next time, keep moving forward.